Welcome to this video on cardiovascular drugs for the PTCB 2026 exam. This study guide covers practice questions, drug interactions, and exam strategies. We will start with an overview of cardiovascular drug classes. Key classes include anticoagulants like warfarin, antiplatelets such as aspirin, and ACE inhibitors like lisinopril. Anticoagulants prevent clotting. The timeline shows drug discoveries from heparin in the 1920s to modern DOACs like apixaban and rivaroxaban, which currently have the highest prescription volume. Antiplatelet agents like aspirin and clopidogrel inhibit platelet activation and aggregation. Their mechanism of action involves blocking specific receptors and enzymes, reducing thrombus formation. ACE inhibitors and ARBs both treat hypertension and heart failure, but via different mechanisms. ACE inhibitors block conversion, while ARBs block receptors directly. Both share contraindications like pregnancy. Beta blockers reduce heart rate and contractility. They are categorized as beta-1 selective like metoprolol or non-selective like propranolol. Counseling is vital, especially regarding abrupt cessation and use in asthma or diabetes. Calcium channel blockers are divided into dihydropyridines like amlodipine, which primarily cause vasodilation, and non-dihydropyridines like diltiazem, which affect heart rate and contractility. Diuretics are classified into loop, thiazide, and potassium-sparing types, each with unique mechanisms, uses, and electrolyte monitoring needs. Always consider pregnancy and lactation guidelines. Statins, or HMG-CoA reductase inhibitors, reduce cholesterol synthesis. Their primary goal is to reduce LDL and total cholesterol. Common contraindications include pregnancy and lactation. Antiarrhythmic drugs are classified by the Vaughan Williams system. Classes I, II, III, and IV block specific channels or receptors to regulate heart rhythm, each with distinct key drugs and safety warnings. Critical drug interactions, starting with warfarin, increase bleeding risk when combined with NSAIDs or amiodarone. As a pharmacy technician, identify these interactions and alert the pharmacist immediately. Part 2 of critical drug interactions covers cardiac medications. Interactions include amiodarone and digoxin, ACE inhibitors and potassium, and statins and fibrates. Close monitoring is essential for patient safety. Regarding pregnancy and lactation safety, certain ACE inhibitors, ARBs, and statins are high risk. Safe options include low-dose aspirin and labetalol, a preferred beta blocker. Understanding ADME properties, specifically absorption and bioavailability, is key to drug efficacy. The first pass effect can reduce oral bioavailability, which is why IV drugs are 100% bioavailable. Drug distribution and protein binding impact a drug's concentration and effectiveness. Highly protein-bound drugs like warfarin can be displaced, increasing the risk of toxicity.